Hi, I'm Karen Williams, and I'm going to give you a speech on diabetes, the deadly disease. Type 2 diabetes is the leading cause of kidney failure, lower limb amputation, and new cases of blindness among adults in the United States. As a daughter of a diabetic and also a licensed nurse for 15 years, I have seen the devastating effects of diabetes. Today I would like to inform you of the symptoms of diabetes, the daily blood monitoring, levels of sugar, and the signs and symptoms of hypo and hyperglycemia. Let's start with diabetes. Population in the United States is diagnosed with diabetes, with rates varying by region. In 2007 to 2009, the national survey data for people ages 20 years older indicates that 7.1% of non-Hispanics have diabetes, 8.4% of Asian Americans have diabetes, 11.8% of Hispanic Latinos have diabetes, and 12.6% of non-Hispanic Blacks are diagnosed with diabetes. Among Hispanics and Latinos, rates were 7.6% for both Cuban Americans and for Central and Southern Americans. 13.3% of the Mexican Americans and 13.8% of Puerto Rican Americans have been diagnosed with diabetes in the United States. Now that we have discussed the population at risk, let's discuss the signs and symptoms of diabetes and the ways to control it. Predisposed symptoms of diabetes can be monitored and controlled in different ways. Many people have these symptoms way longer before they are diagnosed. Patient education and self-care practices are important aspects of the disease and how to manage it. Diet, insulin, oral medication to lower blood glucose levels are the foundation of diabetes treatment and management. Many people with type 2 diabetes can control their blood glucose by following a healthy meal plan and an exercise program, losing excess weight, and taking oral medication. Hypoglycemia is when your blood sugar maintains at a lower level. The normal level for your blood glucose should be between 80 and 120. Hypoglycemia symptoms can range from hunger, shakiness, nervousness, sweating, dizziness, lightheaded, sleepiness, confusion, difficulty in speaking, anxiety, and weakness. Hyperglycemia is when your blood sugar consistently runs on above 150. Symptoms can include high blood glucose, high levels of sugar in the urine, frequent urination, increased thirst, and ketones found in the urine, which have to be detected by a blood test. Controlling diabetes can range from medical intervention to self-care intervention. Self-management education or training is a key step in improving health outcomes and your quality of life. It focuses on self-care behaviors such as healthy eating, being active, and monitoring blood sugar. It is a collaborative process in which diabetes educators help people with or at risk for diabetes gain the knowledge